Myasthenia gravis. Introduction. Myasthenia gravis is a disease that affects the muscles, causing them to become weak. Medication is available to treat myasthenia gravis. However, medical emergencies can arise if the disease affects the breathing muscles. This patient education program will help you understand what myasthenia gravis is and how it can be treated. The causes and symptoms of this disease are reviewed also. Myasthenia gravis. Myasthenia gravis is a disease that causes weakness in the voluntary muscles of the body. This muscle weakness usually occurs during periods of activity and improves after periods of rest. Certain muscles, such as the ones controlling eye movement, facial expression, chewing, talking, and swallowing, are often involved in myasthenia gravis. Myasthenia gravis may also affect the muscles that control neck and limb movement and breathing. Myasthenia gravis means grave muscle weakness. However, due to recent advances in medicine, most cases of myasthenia gravis are not as grave or serious as the meaning implies. Myasthenia gravis is not contagious or fatal and does not affect life expectancy. Myasthenia gravis affects all ethnic groups and both genders. It can occur at any age, however, it most commonly affects women under the age of 40 and men over the age of 60. Causes. In order to understand the causes of myasthenia gravis, it is important to know how the nerves and muscles work together to make movement. It is also necessary to understand the body's immune system. The body has two kinds of muscles, voluntary and involuntary. We directly control voluntary muscles to make the body walk, run, write, lift, smile, and chew. Involuntary muscles work on their own. These muscles are found in the stomach, intestines, colon, and blood vessels. The brain controls voluntary muscles by sending messages through the nerves. Messages go from the brain to the spinal cord, then through the peripheral nerves to the muscles. Nerves are made of cells called neurons. A neuron has a long fiber called an axon that electrical impulses travel through. When messages from the brain arrive at the end of a nerve, they are transmitted to the muscle. The space between a nerve ending and a muscle is called a neuromuscular junction. As messages arrive to the neuromuscular junction from the brain in the form of electrical waves, they release in that junction special chemicals called neurotransmitters. When acetylcholine, a neurotransmitter, reaches the muscle side of a neuromuscular junction, it locks into special keyholes called receptors. Locking acetylcholine into the receptors causes the muscles to contract. If anything interferes with the steps needed to transmit brain messages across a neuromuscular junction, the nerves will not be able to control muscle contractions. Myasthenia gravis occurs when normal communication between nerves and muscles is interrupted at the neuromuscular junction. The interruption is due to antibodies that prevent acetylcholine from reaching the muscles by destroying or blocking the receptors. Antibodies are substances made by the body's immune system to fight germs and infections. The thymus, a small gland located under the breastbone, is very important in the development of the immune system early in life. In adults with myasthenia gravis, the thymus gland is abnormal. Some patients with myasthenia gravis develop abnormal growths or tumors in the thymus gland. These tumors are usually benign and non-cancerous. Although the relationship between the thymus gland and myasthenia gravis is not clear, scientists think the thymus gland may be responsible for the immune system attacking acetylcholine receptors. Symptoms: